Hey, welcome everybody. I'm Gary Letourneau. I'm the Vice Chair of the Health and Wellness Committee. And today we have the pleasure of having Dr. Heather Shenkman, who's here to speak. She's indicated that if you have a question while she's speaking, just please speak up, raise your hand, and we'll deal with that at the time. A couple comments about Dr. Shenkman. Number one, when I searched for cardiologists to speak, I have friends at the Physicians Committee for Responsible Medicine in Washington, D.C., and they recommended her highly. She has presented to them, and she is very, very capable. She describes herself as an interventional cardiologist, and she will explain what interventional means, of course. And she practices in Tarzana, California. And she's currently on the board of directors of the California chapter of the American College of Cardiology. And she represents the cardiologists in the San Diego, or in the San Fernando Valley. She grew up in the Detroit area, went to medical school in Albany, and did a residency training at Henry Ford Hospital in Detroit. And she completed her cardiology fellowship training at the University of Rochester, New York. So it's a great pleasure for us, or for me, to welcome Dr. Heather Shenkman. It's yours. Thank you very much for being here, Dr. Shenkman.
Great. Well, I have to thank you very much for inviting me. I'm going to share my screen now. There we are. Okay. Do you see my slides?
Yes. Yes.
Great. There we go. Okay. All right, so Gary, thank you for the kind introduction. So I'm Dr. Heather Shenkman. I am an interventional cardiologist, which means that I am able to do procedures to open up blocked arteries should I need to. For example, somebody who's having a heart attack often will have a blocked artery that can be opened up to literally save a life.
So Dr. Shenkman,
yes.
I hate to interrupt you, but I want to point out that we are seeing the presenter's view of your PowerPoint. Oh. In case that was not your intention.
No, that probably was not. I apologize. I am not the most Zoom savvy. New share. There we go. All right, how's that?
It's the presenter's view. One quick fix. Oh, that's perfect.
All right. Thank you for your patience. All right. Good. All right. Thank you for letting me know that. So an interventional cardiologist, I can open up an artery that's blocked and save a life in the setting of a heart attack, but I have a more preventive bend to me, in that I like to help my patients prevent that from happening in the first place, or if they've had that happen before, prevent that from happening again. So who I am, I'm a full-time interventional cardiologist. I do have a background in triathlon. I have completed 2 Ironman distance triathlons. I've competed internationally at the Maccabiah Games in Israel. I've done century cycling rides. I've done triathlons of all distances. I even dabbled in swim meets. And even though I now have a 2.5-year-old daughter and I haven't signed up for a race in a few years, staying active and healthy is very important to me. I also wrote a book. It's called The Vegan Heart Doctor's Guide to Reversing Heart Disease, Losing Weight, and Reclaiming Your Life. And it summarizes what I would want my patients to know about eating, about how to start exercising, and how to put it all together, and all about what heart disease is as well, just so that one can be an educated patient and take that with you and be able to use that knowledge to take better care of yourself. So what is a plant-based diet? So a plant-based diet is a vegan diet, which means there are no animal products. but it is predominantly vegetables, grains, beans, fruits, nuts, and seeds. Processed foods are at a minimum. So this is not a healthy plant-based diet. This is a vegan diet. There are potato chips, there is soda. None of this comes from an animal, but this is not a healthy plant-based diet. Now, plant-based diets are actually appropriate for all stages of life. If you were to go back to like 1970, people would say, well, a vegetarian diet, you have to make, or a plant-based diet, you have to combine certain proteins to be able to be healthy, and you're going to be deficient in this and deficient in that, and you need meat. But at this point, we actually know that plant-based diets can be suitable for all stages of life and actually can be beneficial for health. And this is from the Academy of Nutrition and Dietetics. This is their position paper. They state that vegetarian, including vegan diets, are healthful, nutritionally adequate, and may provide health benefits for the prevention and treatment of certain diseases for all stages of the life cycle, including pregnancy, lactation, infancy, childhood, adolescence, older adulthood, and for athletes. On a personal level, I was pregnant. I was plant-based throughout my entire pregnancy. I breastfed for a long time. I have a toddler who is 2.5 years old who has been on a vegan diet from the beginning. I have 4 nieces who are also all vegetarians and thriving. And I was an athlete as a plant-based person, and felt like I actually probably was able to recover faster than my fellow athletes who were eating food diets that were not plant-based. Also, vegetarian and vegan diets are at a reduced risk of certain health conditions, including ischemic heart disease, type 2 diabetes, hypertension, and certain kinds of cancer and obesity. So this is a table showing what the most frequent causes of death are in the United States in the years 2019, 2020. Even with COVID, heart disease was still the #1 cause of death, cancer being #2, COVID #3, and then stroke is #5. And I circle stroke as well because the causes of stroke are very often along the same lines as the causes of heart disease. So when we talk about heart disease, there are several different kinds of heart disease. And for the most part, we're going to be talking about coronary artery disease, which is plaque in the arteries of the heart. That said, there are all sorts of other issues and diseases of the heart. For example, there is congestive heart failure, which is the inability of the heart to pump the volume of blood that it needs to throughout the body. Hypertension, which is high blood pressure. Arrhythmias, which are abnormal rhythms of the heart. Problems with the heart valves, and then congenital abnormalities, which are abnormalities of the heart that occur from birth. So heart disease by the numbers. I think to me, the most striking of these is this here, that 80% of heart disease and stroke is preventable. And that's why we're here, to talk about how we can prevent these things. So what is coronary artery disease? Coronary artery disease is basically the buildup of plaque within the arteries of the heart. And we have arteries that supply blood to all parts of our bodies. We have arteries that supply blood to our neck. These are our carotid arteries. We have arteries to our legs to supply blood to the leg muscle. We have arteries that supply blood to all of our organs. The heart being a muscle, it requires blood. It requires the nutrients and oxygen supplied to it. And when plaque builds up within those arteries, that is called coronary artery disease. There are risk factors for coronary artery disease. Some of them are modifiable, some of them are not. So your genetics, unfortunately, if you have family members who had heart attacks and strokes at young ages, you're going to be more likely to have those issues at young ages as well. Also, men, particularly before women hit menopause, men have a higher risk of heart attack and stroke. Women, once they reach menopause, that risk actually does go up and gets closer to that of men. So there are multiple modifiable risk factors. And the one we're going to be talking the most about today is diet, because the food that you put into your body can absolutely be critical in reducing your risk of developing heart attack and stroke. Smoking is a very important modifiable risk factor. If you smoke, you need to quit. It in general will shorten your life by many years. Exercise reduces the risk of heart attack and stroke. Controlling blood pressure, controlling your cholesterol numbers, diabetes, if you're a diabetic, making sure your diabetes is under good control, and managing stress in your life, also critical for reducing risk of coronary artery disease and the consequences of it. So a coronary angioplasty, that is a procedure that I personally perform. And it is a procedure through which you can go through the artery in the wrist, which is the radial artery, or the artery in the leg, which is the femoral artery. Catheters can be fed all the way up to the heart, dye injected into the arteries of the heart, and then X-ray pictures are taken to assess the arteries to see whether they are open, whether there are narrowings. If a narrowing is found, a wire can be passed down the artery, and then a balloon can be passed over that wire, and then the balloon can be inflated, which will widen the artery, and then a tube called a stent can be put into the artery to hold it open. This is a picture of a cardiac catheterization laboratory. This is where these procedures take place. The patient is the one lying here on the table. These are the X-ray images. This is what we call the image intensifier that helps us to obtain these images. This is probably the cardiologist here, and then next to it's probably a him in the red cap. That is the technician who is helping. So what is bypass surgery? Bypass surgery is simply a surgery that bypasses blockages. It doesn't clean anything out. It doesn't replace arteries. It just routes passages around blockages such that blood can get to the heart muscle. Vein bypasses come typically from the legs. So there's an extra vein in our leg that can be cut and can be sewn onto the heart. So one part of the vein will be sewn onto the aorta, the big blood vessel coming from the heart. Oops, what did I just do? There we go. And then the other part of the vein can be sewn onto a part of the artery distal to a blockage. So basically if there's a blockage here, we are bypassing it. Now, these unfortunately are not terribly sturdy. At about 10 years, about half of these vein bypasses are occluded. Now, we can also take an artery from inside the chest. We have an extra artery that we really don't need. It's called the left internal mammary artery, and that can be rerouted and taken off of the sternum or chest and can be placed onto one of the arteries of the heart. And that can also serve as a bypass. And that's a pretty sturdy bypass. So studies worldwide have shown that diets that are more plant-based have a lower risk of heart disease, high blood pressure, diabetes, intestinal disorders, several kinds of cancer, osteoporosis, kidney stones, and gallstones. Unfortunately, how we eat is not necessarily designed for health. In general, in the United States, the standard American diet is 39% added fats, oils, and sugars. It's 30% animal products, about 22% grains, and then only 9% of the diet typically comes from vegetables, fruits, and legumes. Now, Colin Campbell is the author of a book called The China Study, and he is a nutrition researcher who has published on the diets, particularly within China, comparing the traditional Chinese diet to a more Western style of diet in China. It's been influenced by the West with fast food and animal products and whatnot. And his conclusion from that is that the vast majority of all cancers, cardiovascular disease, and other forms of degenerative illness can be prevented simply by adopting a plant-based diet. Blue zones are areas of the world where people tend to live a really long time, where people who live to be 100+ years older is actually more common than other places. And there are 5 blue zones. One of them is here in the United States. It's Loma Linda, California. There's also Nicoya, Costa Rica, Sardinia, Italy, Ikaria, Greece, and Okinawa, Japan. And these 5 places have several things in common. So lifestyle practices common to all of these blue zones is that family is important. There's a very, very low prevalence of smoking. People tend to be socially engaged with one another. There is constant moderate physical activity. People are moving around. They tend to eat a more plant-based style of diet, and they consume more legumes. Now, for example, the Okinawan standard or Okinawan traditional diet, you may think that the Okinawans eat a lot of fish, and the traditional diet from there actually is not. So actually in Okinawa, 70% of calories from a traditional diet come from sweet potatoes, 12% from rice, 7% from grains and wheat, 6% from soy and legumes, 4% additional vegetables. And then it's actually a very, very small amount coming from animal products, 1% from fish, 1% from dairy, 1% from eggs, 1% from pork and meat, 1% from added sugars. And it's certainly a very different style of diet than what we are used to eating. The Adventist Health Study is a study of Adventists to look at diet, diet pattern, and health. So this study was conducted in the early 2000s. 96,000 Adventists were recruited from the United States and Canada, and they had a variety of different health habits. So 8% of them were vegans. And amongst Adventists, vegetarian and vegan diets actually tend to be more prevalent. 10% were pesco-vegetarian, 6% semi-vegetarian, and 48% were non-vegetarian. These were generally healthy people, a very, very low incidence of smokers, and only 7% drank any alcohol at all. So looking at the weight difference amongst the participants of the Adventist health study. So looking at a woman at an average of 5 feet 6 inches tall, a vegan woman would tend to on average be 146 pounds, whereas a non-vegetarian woman would tend to be 180 pounds, and lacto-ovo, pesco, vegetarian, semi-vegetarian in between. And for men, also a significant difference. So for men, the average man at 5 feet 10 inches tall would be 161 pounds, but a non-vegetarian man would be 193 pounds. So a significant difference in body size dependent on the diet that is followed. Now, those who have diabetes, also a significant difference. So amongst vegans in this study, about a little over 2% were diabetics. Those who were lacto-ovo vegetarians, a little bit more, and then the non-vegetarians, close to 8%. So almost a fourfold difference in prevalence of diabetes in non-vegetarians compared to vegans. Now, red meat and total mortality, this is also within that study, looking at how many servings of red meat people would consume. Using those who consume no red meat as a control, the more red meat per day, going up from 1 ounce to 2 ounces to 3 ounces, your relative risk, your risk of total mortality goes up. So if you're consuming 3 ounces or more of red meat per day compared to not consuming any, your relative risk of death in this population was double. Now, coronary artery disease mortality, comparing the non-vegetarians to the vegans, there's definitely more coronary heart disease death amongst those who are non-vegetarians and semi-vegetarians. You get down here, yes, the pesco-vegetarians may be a little bit lower, and I don't know if that's statistical, if there's statistical significance, but those who are on the more vegetarian realm of things tend to have a lower risk of death from heart disease. Now, Dr. Kim Williams is the former president of the American College of Cardiology, and he has a phrase that he likes to share. There are two kinds of cardiologists, vegans and those who haven't read the data. So we are going to talk a little bit more about the data behind specifically diet and coronary artery disease. Now, Dean Ornish may be somebody you've heard of. He is somebody who came up with a program for helping to help patients with heart disease. And there was diet to it, but there were other components as well. It was a low-fat vegetarian diet. There was moderate exercise, stress management, quitting smoking, and group support. Now, his diet consists of plenty of fruits, vegetables, grains, legumes, and soy. There is no restriction in the number of calories that you can consume on the diet, but naturally on the diet, fewer than 10% of calories came from fat. There were no animal products allowed except for egg whites and about 1 cup per day of non-fat milk or yogurt. There was no caffeine and limited amounts of alcohol. Now, the study broke the patients up into 2 groups. There was a control group, and these were people who were not advised on these changes, but they were advised they can make changes if they want. They actually had progression of their coronary artery disease. The average narrowing increased from 42% to 46%, and they actually had more angina or more heart-related chest pain. Now, the experimental group, these are the folks who went on the low-fat, most vegetarian diet with the group support, meditation, exercise, smoking cessation advice. This group actually had reversal of their coronary narrowings. And even though the number is small, so from 40 to 37.8%, we put this into perspective. Our expectation is that people will have progression of their coronary disease. And a lot of people believe that you're going to have progression of your coronary disease no matter what you do. But in this study, Dean Ornish looked at coronary angiograms and found that there was actually some degree of reversal. So the fact that there was some reversal noted is a big deal. Patients had less angina, a lot less heart-related chest pain. And of the patients who participated, 82%. So 4/5 of all patients who participated had reversal of coronary narrowings. Now, Dr. Caldwell Esselstyn, he is actually a breast surgeon, but he is somebody who has an interest in diet and heart disease. He himself, I believe that his father had coronary disease diagnosed at age 47. So what he wanted to do is he actually wanted to see if what he could do with the sickest of the sick with coronary disease. And this was a diet alone, that all he did was put these people on a pretty strict plant-based diet. He found patients who had severe 3-vessel coronary artery disease, and he put them on a strict vegetarian diet. He recruited 21 patients, provided quite a bit of guidance to these folks, and 17 of them followed the diet. And then there were 11 where we could really get good data, and we were able to look at angiograms or detailed look at the arteries before and after. Excuse me. So his diet, what was allowed? Whole grains, legumes, lentils, vegetables, and fruit. So what was not allowed? No animal products, but also no nuts, no oil, no seeds, no avocados. And that's a pretty drastic. That's not just vegan. That's not just plant-based. That is more than that. So he actually was able to get most patients to be able to follow this diet with guidance. Now, 8 years before the study, this is a pretty sick group. And the reason I show this slide is because this was a really sick group of people. They had 3-vessel coronary arteries, all plaque in all 3 major arteries of their heart. In the 8 years before they were enrolled, there were 37 events in these 11 patients, 15 events with increased angina or heart-related chest pain, 6 events where there was noted progression of plaque buildup. 6 of these patients had bypass surgery. There were 4 heart attacks, 3 strokes, 2 angioplasties, and 1 person with a worsening stress test. However, after the study, these folks were followed for 10 years. Of these patients, there were 0 events in 10 years being on this particular diet. All right. And this is a coronary angiogram of one of the patients who was enrolled in Dr. Esselstyn's study. The angiogram number A, this is a left anterior descending. This is an artery that runs along the front wall of the heart. You can see up here at the top, it's nice and wide, but as you get further down the artery, it looks like a string. And the reason is that dye fills the lumen. And if there's a lot of plaque, you're going to have this string, because that's the extent of the width of the artery, because it's so filled with plaque. So before the study and then after the study, and this is 32 months on a plant-based diet. This patient actually was not on any type of cholesterol lowering medication and had significant improvement. Now, I want to add the caveat that the study was done in the 1990s. At that time, statins, or cholesterol lowering medications, which are an absolute class 1 indication in people who have coronary artery disease, they were not really indicated at that time. So a lot of these patients with severe coronary artery disease were not on statins. Now, statin medicines, we know, actually do have beneficial effects in helping to reverse plaque as well. So a patient like this in this day and age, we would advise a healthy plant-based diet in conjunction with statin medication. And this is another patient who had a narrowing in the artery. This is before and this is after, and this is about 60 months of a plant-based diet, and this is a patient who was on cholesterol-lowering medication. Now, Dr. Caldwell-Esselstyn has responded to the criticism of the diet that he has offered. A whole food plant-based diet, no nuts, no seeds, no avocados, no oil, no fun. And what he says is some people think that the plant-based whole food diet is extreme. 500,000 a year will have their chests opened up and a leg taken from their leg and sewn onto their coronary artery. Some people would call that extreme. Now, this is a study looking at a heart of somebody who was on a plant-based diet for only 3 weeks. This is a PET scan before. These bright areas demonstrate where there is good blood flow to the heart. And then this area where there is really no color, that's an area where the heart is not getting much blood flow. So this is so this first one here, this is before, and then down here, this is after. And you can see that after 3 weeks, you get better blood flow to all portions of the heart. Now, the next question is, let's say you want to improve your heart health, but going full bore plant-based is not in the cards for you. Can you have improvement in your heart health through eating more Mediterranean? And this is the Lion Heart Study. This is a large study that was done in France. And it looked at people who had a history of heart attack. It tested the effect of a Mediterranean style diet compared to a Western diet. Now, the experimental group were put on a Mediterranean diet that included more vegetables and fruit, less beef, pork, and lamb. It did include more poultry and fish, and butter and cream were replaced with a margarine that was high in alpha-linoleic acid, which is an omega-3 fatty acid. Now, those patients who followed a Mediterranean-style diet had a 50 to 70% lower risk of recurrence of heart disease. So even making these changes, short of going whole food plant-based, did make a significant difference. And here is a graph. So those who were on the Western diet, this is the freedom from heart events. So as you can see, there were a fair amount of heart events in this Western diet, but those who were on the Mediterranean diet did better. Now, even our American College of Cardiology and American Heart Association is more inclined towards promoting plant-based diets. This is their recent smart plate for health. You can see that vegetarian diet is one of the diets that is recommended as a heart healthy pattern of eating on the plate. We have whole grains, nuts, veggies, fruits, and we have what looks like tofu and edamame, but also the option of lean meat. But that said, there is the recognition that yes, indeed, a plant-based diet can be very healthy for heart health. Now, President Bill Clinton, he underwent bypass surgery in 2004. And then in 2010, he underwent an angioplasty to open up one of his bypass grafts that had completely blocked off. At that time, he chose to adopt a plant-based diet, and he lost weight. Now, from my knowledge, I don't think he's been entirely adherent to a plant-based diet, but he's done pretty well, certainly a whole lot better than he had in the past, and he's had no cardiac or heart-related issues since then. Now, vegetarians also have lower blood pressures. So up here, we have a blood pressure that has two numbers. The systolic is the top number, the diastolic is the lower number. The top number of those who were enrolled in the East Boston and Framingham study, they had higher top numbers, and they also had higher bottom numbers than those who were on vegetarian style diets. High blood pressure and diet, definitely those who have high blood pressure, vegans in the Adventist Health Study had a 10% prevalence of high blood pressure compared to those who were non-vegetarian, who had upwards of 25% of all people having high blood pressure, and those on the realm of vegetarian diets having amounts in between. Now, the DASH diet, this is an eating plan that was designed to help to lower blood pressure. And this is what we are told to advise patients with high blood pressure, that a diet with plenty of grains, vegetables, fruits, low fat or fat-free dairy products, meats, poultry, and fish, that this is what people should be eating. Now, what's interesting is that if you look at the actual paper that came out, and I love this sentence, I think it's very interesting, it's very telling. The diet design goals were to create patterns that would have the blood pressure lowering benefits of a vegetarian diet, yet contain enough animal products to make them palatable to non-vegetarians. In other words, it seems that they acknowledge that a vegetarian diet is going to be best for heart health, but people can't do it, so here's the option. So I'm going to conclude there. I think I've left like a lot of time for questions here. This is my book. I welcome you to buy it. Again, I talk about what heart disease is, and I talk about adopting good habits towards keeping your heart healthy for years to come. My book is available on Amazon. If you are looking for a cardiologist and you're in California, you can I do telemedicine consultations. I do in-person consultations in my office as well. And my website's a good place to reach me. Every so often I post on Twitter and Instagram, and I share cute pictures of my 2.5-year-old on Instagram. So
Dr. Shenkman, I have a question.
Yes.
First of all, I loved your presentation. Thank you very, very much. Your slides were just amazing. Are the slides, the information from the slides, are they in the book, in your book?
In general, they are the subject of my book. They themselves have been updated since the book was published in 2018. Though.
Yeah. Are your slides available for purchase on Amazon?
My slides are not available for purchase on Amazon.
Okay. Thank you. Okay.
I can make them available if anybody wants to see them.
I'd love to see them. Yeah.
Okay, you got it.
Yeah. Okay. Thank you. Anybody else have any questions? I think the presentation, but you were not aware, but I've been following Dr. Esselstyn for now probably 10 years or so, and it's made a huge positive difference in my life, my health, and I had considered others before, and I wanted, my opinion, I wanted to do the real thing, and Dr. Esselstyn had that, and I have no regrets at all about having done. So, comment. Anybody else have any questions or comments you want to make about Dr. Shenkman's presentation? She's here. She's available.
Yeah, hey. Hey, my name is Zeb. Can you hear me okay?
Oh, Zeb. Yes, we can.
Great. Well, thank you, Doctor, for the presentation. If you're someone who really likes eating meat and dairy products and that sort of thing, but has interest in becoming a vegan, what is the first step to kind of trying that out?
That's a really good question. So it's how to transition to a plant-based diet if you're somebody who does consume a lot of animal products. I think it really varies from person to person. Some people just overnight go cold turkey, cut it out, and go full bore plant-based and feel great doing it. But there's certainly more gradual ways of going that way. I think a lot of people make the mistake of cutting things out. So they cut out dairy, they cut out eggs, they cut out milk, and then they're not left with that much. I think that a good approach is for some, maybe to start adding things in. So maybe add in a couple of plant-based meals a week that you wouldn't otherwise have. So maybe add in a tofu stir fry where you would otherwise have something that was a meat dish. Also, there's replacing things as you go. So for example, if you're used to having like coffee with milk or creamer, find like a non-dairy like plant milk to put in your coffee, or a non-dairy creamer to put in your coffee. And by the way, I'm not non-dairy creamer, because non-dairy creamer actually does have dairy in it, in the form of casein. So things like almond milk creamer or soy creamers can be good choices. For my coffee, I like soy milk. I make myself a soy latte every morning. Or when it comes to replacing things like meat, if you really love meat, there are meat like replacements that are vegan. They may not be the healthiest of choices, but they may be healthier choices than the actual forms of the animal foods. So perhaps adding those things in. I think from person to person can vary how you transition.
Thank you.
Just a comment in response to Zeb's question. I was faced with that question, and of course my health status at the time was not wonderful, and I just went completely 100% with Esseltyn's, and I never looked back. I mean, I had weight issues, the weight melted away. I've been able to keep 40 pounds off easily for over 10 years now. And my blood pressure, my total blood cholesterol, everything. And I, when I was eating before, the standard American diet, I just didn't like the way food made me felt. And I just feel so much better now. I could not imagine going back to eating the way I grew up eating. A lot of dairy products, a lot of red meat. It was just, I just could never, now that what I know now, I would never go back to eating that way. My thoughts. Does anybody else have any questions, comments, thoughts, opinions? Well, I know I'm going to go to Amazon when this program ends and order your book, Dr. Shenkman. And
thank you.
Thank you very, very much.
Gary, I'll go ahead and add a question.
Yeah, Lauren.
Along the lines of transitioning to a more plant-based diet, Dr. Shenkman, do you have any thoughts about alternative meat products that are mass-produced, like Impossible or Beyond Meat?
That's a really good question.
Okay.
So,
Great question.
Yeah. The alternative meats, I think that depending on which one you choose, it is not necessarily going to be the healthiest of choice. A lot of the vegan burgers will have a lot of oil, a lot of salt, a lot of processed things in them. That said, I'm going to be honest. I am a vegan. I do every so often. I like some of the Gardein brand of plant-based, fake chicken nuggets and things of that sort. I personally do consume those from time to time. But I think it's, when you're looking at the greater rest of your diet, looking towards more whole plant-based types of foods is ideal.
Yeah, let me comment on Lauren's question, if I may. I mean, my experience is, as Dr. Shenkman said, those are all highly processed foods, which are basically very unhealthy. And I have vegan burgers sometimes, a few times I've ordered them in a restaurant, and I've always been disappointed. They're just, I just am not, that's not something for me. It may be for other people, but given the ingredients in those products, highly processed, as Dr. Shenkman said, oil, sodium, that's not something that I'm going to eat. Nobody else has any other questions?
I do have a question.
Oh, good, Dana. Dana.
Thank
Please,
you,
thank you,
Doctor, for your presentation. I'm just kind of curious about the contribution to heart health, and what, in your research and your experience, how much of that is, like genetics versus environment, I guess, because obviously some of us have family histories or things like that.
Good.
If you have any
question. Good question.
That's a very good question. A phrase that I've heard before is genetics loads the gun, lifestyle pulls the trigger. I think there's definitely something to be said for people who do have family histories, but even those who have the worst of family histories, diet can help to prevent coronary disease, or at the very least, a good lifestyle and diet can help to at least delay it down the road a few decades, depending on what type of lifestyle one follows. But yes, lifestyle does have a strong impact, even in those who have the most horrible of genetics.
Right, and we also received another question in the chat from Marla. Are there limits on how much soy women should eat, and does it vary by age or life stage?
Okay, that's a great question. I'm so glad you asked that, because there's a lot of misconceptions about soy, that soy, it has estrogen, that it's going to cause you to get breast cancer, that if you're a man, you're going to grow boobs. And most of that really is unfounded. I think that in general, people who consume soy products actually tend to, and when we say soy, we're talking about in forms of like tofu and edamame and soy milk, so unprocessed or minimally processed, actually have lower incidences of heart disease and lower incidences of breast cancer. I would say certainly don't go to extremes with soy. I read something in a magazine where somebody was consuming like 4 gallons of soy milk a day and developed some man developed gynecomastia from that. Like, that's obviously an absurd quantity of soy milk to be consuming. But if you're consuming normal amounts, a few servings a day of soy products, there really shouldn't be any adverse problems from that. In fact, health benefits from it.
Doctor, as a follow-up to that question, and kind of going back to one of the prior questions about those of us who are meat consumers, let's say, or not, but are looking to, be healthier, kind of on that question of soy is, if you're a dairy consumer, is even the shift from dairy to soy-based products a healthy start, I guess, maybe?
So the question is shifting from dairy to soy a healthy choice? And I think it is. Certainly if you're going from dairy, which has saturated fat in it and has hormones from the cow, to like a soy milk, I think that's a positive change. You still get the calcium, you still get the protein if you're consuming a soy milk. Good. What other questions can I answer, if any?
Well, I have another question. Dr. Esselstyn is fairly well known, I think, for not doing open heart surgery, but on the contrary, having people eat greens a pound per day, 3 times, well, split out, divided 6 times a day. And to what extent are other cardiologists, for example, what's your opinion on that? Someone comes in and they've been told by, say, for example, hypothetical case, another cardiologist, that you need open heart surgery like tomorrow, and they came to you for a second opinion. In terms of your recommendations, and I realize we don't have the patient here in front of us, but would you ever suggest or recommend that that person just get Esselstyn's book and start on that particular rehearsal program? I mean, I think it worked for me and it's worked years for other people. What are your thoughts, please?
I think that it really depends on who that person is coming in. There are certain anatomical situations of the heart. So if somebody has left main coronary artery disease, like severe left main coronary artery disease, or severe 3-vessel coronary artery disease with certain portions of, say, the left anterior descending artery affected, that is somebody who there is a class 1 indication. I mean, that's somebody who's too far progressed in their disease. Yeah, they're going to benefit from eating plant-based, but they really need that bypass to save their life. There's somebody who's having a heart attack. You know, I'm not going to say, okay, we can do an angioplasty or you can have salads. That's somebody who's like in the throes of a life-threatening situation. That's somebody who needs the bypass surgery or the angioplasty. So I think there are certain, just to try to summarize, there are certain critical conditions within cardiology where things have probably gotten too far, and that's somebody who is going to need something invasive done. But that said, regardless, they're going to do better in the long run if they adopt a healthy plant-based diet.
Okay, great. Thank you. Thank you. Any other questions, comments, thoughts? Anybody?
I actually have a question. This is Pam Swift. I want to know, you hear about the life scan testings that they have, and they can give you an idea about plaque buildup. Is that something that you consider valid? And my second question on that is, other than doing angioplasty, how else would you find out about the existence of plaque?
I'm so sorry, I missed the second half of that.
Other than angioplasty, are there any other tests, medical tests available to determining the extent of plaque in the arteries?
So I'll answer the second part of your question first. So to evaluate the extent of plaque within the arteries, there is a non-invasive CAT scan or CT coronary angiogram that involves injecting dye into the arteries. That's not typically a first-line test we recommend because tests with dye, there's potential risk to the kidneys, there's radiation exposure. I think it really depends on the scenarios. Certainly tests that can help to evaluate and diagnose for coronary artery disease include stress testing with a treadmill or stress testing using a chemical medicine to make the heart work harder. There's also a good screening test called a CT calcium score. It's a coronary calcium score. It's a CAT scan that has a very, very low amount of radiation. It's a very quick test, and it basically counts the amount of calcium that is in the arteries of the heart. It gives you a score. So a score of 0 calcium means that somebody who's going to do very well in the long term, and the more calcium that is found, the higher risk you are. And then the first half of your question, I apologize if you don't mind repeating that.
You hear, you get the mailings for LifeScan.
Yes.
Those types of tests. Is that a waste of money, or is that something that has some validity?
I think honestly, the things that are offered there are things that, if are appropriate, can be obtained through your primary care doctor and or through a cardiologist if you are referred to see one.
Mm-hmm. Mm-hmm.
Thank you. Thank you.
I have a question, Dr. Shenkman. Medical schools if I can say this, are, I think, notorious for being known in terms of the curriculum run by drug companies. And MDs are not taught anything about epidemiology or nutritional science in medical school. And apparently they are not taught those things in terms of training as a cardiologist. The emphasis, of course, is on procedures that can be billed. I think the cost of open heart surgery now is $150,000, which is a very big deal and important to hospitals. And the drugs that are prescribed make it very, very important for drug companies. So what's going on here? Why isn't nutritional science and epidemiology taught to our medical doctors?
It's a very good question. I actually did have a small curriculum on nutrition when I was in medical school, but from what I recall, it wasn't about, eating for heart health. It was more about these are the diseases of nutrition that you see in third world countries of these children with these big bellies that aren't getting enough protein.
Yeah, that's the opposite of what we're trying to do. Yeah.
Yeah, exactly. And I don't know why. There's a lot of information that gets crammed into our heads over the course of 4 years of medical school. And for some reason, nutrition perhaps isn't seen as a hard science to focus on. I don't have a great answer.
Okay. Well, you made an effort. Thank you. Any other questions? Anybody? Well, we're almost out of time. Dr. Shenkman, thank you very, very much. And it's greatly appreciated. And I will tell my friends at the Physicians Committee of Responsible Medicine that you did an outstanding, wonderful job. And thank you very, very much.